You don't like my tie, do you? Left or right?
That way, yeah.
I chose this tie specially as well.
It's a lovely tie.
I'm Dr. Ellis Downs, consultant obstetrician and gynaecologist. I've been working at Portland for about 10 to 15 years, and I've been a consultant for over 20 years. The first baby I ever delivered was when I was a medical student, and I remember going on Saturday morning at 7 o'clock, and I was assigned to this lovely old Irish midwife, and she said, "I'll look after you, let's see what's happening." And I had the privilege of delivering this baby. It was one of the most profoundly moving experiences in my career. And I thought at that day, do you know what? I think I want to be an obstetrician. And that was when I decided I wanted to devote my life to delivering babies and looking after women. Heavy periods are one of the commonest reasons that a woman sees a gynecologist. And happily now, with changing viewpoints, women are no longer prepared to put up with miserable symptoms. Now, when I was a junior doctor, the standard treatment for heavy periods was to do a hysterectomy. Those days have now gone. We now have a much wider range of very effective, safe treatments. We can take non-hormonal medication, which reduces menstrual blood loss by about 50%. And there is also an excellent operation that many people have never heard of. Endometrial ablation is a day case procedure. So you come into hospital, have the operation and go home shortly afterwards. And under general anaesthesia, we do a very careful scald to the lining of the womb so there's nothing to bleed. And research studies show this is 80 to 90% effective. Statistically, we have reduced the chances of a woman needing a hysterectomy for heavy periods by about 90%. As I say to patients, if you've got heavy periods, don't put up with it because there's so much that can be done to improve it. I see many women whose lives are a misery because of repeated urinary tract infections. It's not dangerous, it's not life-threatening, but it's just miserable. Unfortunately, the tube from a bladder, which we call the urethra, in women is rather small. And because of that, it's very easy for bugs to get into the bladder. Women may get symptoms of burning when they're urinating, maybe running to the toilet, they may be getting up at night, and it's all totally miserable. The good news is that this can be very easily treated. The key is to try to understand what's causing it. The introduction of the vaccine against human papillomavirus, HPV, has been a huge success in the United Kingdom. And we have seen a significant reduction in the number of women who sadly are diagnosed with cervical cancer. And it's still important for women who've had the vaccine to have cervical smears when they're called for. For the vast majority, it will be a short-term, self-limiting illness. A pregnant woman has a higher chance of being hospitalised with COVID compared to a non-pregnant woman. And we know that sadly, there is a higher chance of a pregnant woman dying of COVID compared to a non-pregnant woman. So for these reasons, we know it's safe for the mum, we know it's safe for the baby, and we know COVID is a nasty disease, potentially, for the mum. We strongly recommend that pregnant women get advantage of COVID vaccination as soon as they can.